Welcome, and thank you for joining us for this conversation around COVID and cardiovascular health. My name is Guillermo Oliveira, and I'm the Executive Director of the Tampa General's Heart and Vascular Institute. I'm also Chair of Cardiovascular Sciences at Morsani College of Medicine, and I will be your host today. Tampa General Hospital is proud to have joined forces with the American Heart Association of Tampa Bay to bring you this Facebook Live, providing answers to your questions from our medical experts here today. Many of us have struggled through this time, and there are lots of questions that need to be answered and have changed our way of life. I, in the next hour or so, we will address many of your questions regarding COVID and cardiovascular health. If you have any health questions, please place them in our comment section of this Facebook Live. Today, I'm pleased to have four prominent cardiovascular experts joining us here today. Let's start with Dr. Fadi Matar. He's the director of the Tampa General Hospital Cardiac Catheterization Laboratory and associate professor of medicine at USF Health, Morsani College of Medicine. We also have Dr. Arthi Patel, who's the director of the non-invasive cardiology lab and associate professor of medicine at Morsani College of Medicine. And last but not least, Dr. Murray Shames, who's the associate director of the Tampa General Heart and Vascular Institute. He's also professor and chief of the Division of Vascular Surgery at USF Health. And last but not least this time, Kristen Lewis, who's the vice president of health strategies at the American Health Association of Tampa Bay. Thank you all for joining us today to provide this important health update regarding COVID and cardiovascular health. We'll begin our conversation today with Dr. Matar, and he will share some common risk factors of heart disease and how they relate to COVID. I'd like to stress, however, before we go there, that our understanding of COVID is an evolving situation where we get new data and new information every day. And I want this to serve as a disclaimer that some of the things that may be discussed today may change as our knowledge on this subject evolves. Dr. Matar, please welcome and share with us some of the risk factors of related to cardiovascular health in the face of COVID. Thank you.
Thank you, Dr. Oliveira. Heart disease is the most common disease and is very prevalent, and it's very important for us to know what makes us vulnerable to this problem. And I will quickly summarize what are the risk factors, and these are mainly relating to diabetes, high blood pressure, smoking, lifestyle issues relating to obesity and sedentary lifestyle. So patients with the more those risk factors, the more prevalent cardiac disease is. So it's very important that we understand this. And I forgot to mention one more, which is hypercholesterolemia, high cholesterol, which is related to dietary as well as sedentary lifestyle. And another important risk factor would be family history of heart disease. So this is important for us to know this because the more of those risk factors that we have, the more vulnerable we will be to develop cardiovascular disease, which would be coronary disease such as angina, heart attacks, congestive heart failure, strokes, and vascular disease. As far as what's the association between COVID-19 and our risk factors, what we have learned in this pandemic is a few things. One, we noticed that the fatality rate of COVID seems to significantly increase with age. Which is what happens with cardiovascular risk factors. The older we are, the more prone we would be to have cardiovascular disease, which seems to track also with COVID-19 fatality rates. In general, statistically speaking, age 65 or higher is associated with a higher mortality rate should the patient develop COVID-19. And there's some data showing that we may be also more susceptible to become infected if we are older. Now, the question is, why is it so? And there are different theories as to why there is a higher mortality and higher morbidity the more we have risk factors. So, and think about that association into any combination of a few things. One, is it possible that we have the actual virus infect the heart? And would that be the cause of the higher morbidity and mortality? Or is it because there's a significant respiratory component in patients who get infected with the virus that results in a high stress on the heart and low oxygen levels? So if you have underlying cardiac disease, you can get we will be more prone to develop the complications. So it's somebody with blocked arteries, and then they happen to develop the infection, and they become hypoxic, and their blood pressure might increase too much if they're in distress, and that can exacerbate the underlying cardiac problem. So that will be another link to the association. And a third one, is it possible that at a later stage that patients who are at higher risk for cardiovascular disease are more susceptible to have what we call a hyperimmune response to the virus, which seems to be a big component of the complicated COVID cases, where you have an exaggerated immune response to the virus that can go and affect the cardiac muscle itself, which is called the myocarditis, which is inflammation of the heart muscle cells, which could be due to the hyperimmune response. That's the consequence of the COVID-19. So it could be any combination of those three factors that can explain the association between COVID-19 and the cardiac risk factors.
Dr. Matan.
So, yes, sir.
May I ask you a question? In the beginning of the pandemic, the COVID pandemic, there was a concern that there was an association between people taking ARBs and ACE inhibitors with the severity and mortality of COVID. Can you explain to us where that went, and what is the thought now, and whether or not people that are taking those drugs should stop?
Yeah, the data is not definitive about this, but let me backtrack and explain where that concern comes from. And I'll try to simplify it as much as I can. There are receptors in the heart muscles, cells, and vessels of the heart. They're called the angiotensin converting enzyme 2. So these receptors, their function is to counter another angiotensin converting enzyme receptors that are negative, meaning so patients with hypertension or patients with heart failure or coronary disease tend to have high angiotensin converting enzyme receptors as well as enzymes. And the other one, ACE2, angiotensin converting enzyme 2, tend to try to negate the other one. And so what happens, the COVID-19 virus tends to like the angiotensin converting enzyme 2 receptors, and then can reduce them there, so that thereby potentially increasing the risk of having a higher unopposed level of ACE1. So with that, the concern comes the medications that we use for hypertension, which is the angiotensin converting enzyme inhibitors. The concern is it possible they can also inhibit the ACE2 receptors that can exacerbate this problem. we don't have consistent data to show us that using ARBs or ACE inhibitors can systematically worsen the outcomes of patients. So I don't think we know for sure, but it doesn't seem to be that bad after we experienced the pandemic. It was mainly a theoretical concern that I don't think has been proven to be the case.
Well, in fact, there's been some studies suggesting that stopping ACE inhibitors and ARBs in the face of the pandemic can actually exacerbate other cardiovascular diseases and increase mortality, and that the actual initial fears around that issue are not validated, even though there was a theoretical concern. In practical aspects, nobody should at this point stop their ACE inhibitors or ARBs. Thank you, Dr. Matar. I'd like now to speak with Dr. Arti Patel, who will share with us information about the signs and symptoms of a heart attack or stroke, and the treatments that should be undertaken if those symptoms arise. She'll also tell us about how safe it is to come to the hospital in the face of the pandemic and the fear of contracting the virus in the hospital. Thank you, Arti.
Thank you, and I'm happy again to be here today with our panelists discussing this important topic. So first, I just want to talk about some of the signs and symptoms of heart attack and stroke. So with the heart attack, the most common symptom is chest pain, and this is both for men and women. Other symptoms that can occur that represent a heart attack are lightheadedness, nausea, vomiting, jaw, neck pain, back pain, pain that extends into the left arm or shoulder, and then shortness of breath. Now, women can present differently with cardiovascular disease, especially heart attack. So although chest pain is the most common symptom, you want to pay attention to some of the other symptoms that I also mentioned. The key, though, however, for both men and women is to know your body and to look for new and sudden changes, however it presents. As far as signs of a stroke, the American Heart Association actually has a mnemonic to help us remember the common signs. So the mnemonic is FAST, F-A-S-T. So the F stands for facial drooping or numbness. The A is for arm weakness or numbness. The S is for speech difficulty or slurred speech. And if you have those three common symptoms, then the last letter of the mnemonic T stands for time to call 911. So there are other less common signs of stroke to also consider, which can be sudden onset of confusion, severe headache, or numbness anywhere in the body, and then also trouble with vision or walking. So those are the common signs, and those are very important to remember, especially if you have the risk factors that Dr. Matar spoke about. So, you know, a big question is how soon should I present, or how long should I wait before I have these symptoms to come to the hospital? And it's really important that if you have a sudden onset in a symptom that it isn't improving over a couple minutes, or you want to seek treatment immediately. And this is because a lot of the treatments, whether it's medications or procedures that we perform for treatment of heart attack or stroke, really change and are dependent upon the time that the patient first has symptoms. So the best results occur when treatment is started early. So it's important because immediate treatment can minimize the long-term effects of stroke and heart attack and can also prevent death. So really and truly with cardiovascular disease, time is of the essence, and you want to come as soon as you can if you notice something is different or concerning. The last part, especially in the COVID pandemic, you know, there's a lot of concern around coming to the hospital, being exposed to COVID. And so I wanted to address this because, you know, if you have a sign or symptom of heart attack or stroke and you want to seek care, but you're nervous about the risk, I just want to assure you, especially at Tampa General Hospital, that we have safety protocols in place. For example, when patients come into the emergency room, they are screened and tested for COVID. And if someone has a high suspicion or tests positive for COVID, they are treated in a separate area and they receive the same specialized care as someone who is negative for COVID. But we treat patients separately in order to reduce the risk of contracting COVID in that setting. And we found that the risk is very, very minimal. You know, obviously us as cardiovascular disease specialists come to the hospital every day. And so we also take the same precautions when taking care of our patients. So, you know, the moral of the story is if you're sick or having symptoms, it's safe to come to the hospital and get the care that you need in order to minimize any long-term effects to your heart or brain if you're having a heart attack or stroke.
Thank you, Arthi. I'd just like to emphasize that there's been some evidence that cardiovascular mortality outside of the hospital has increased during the pandemic because a lot of people have been afraid of coming into the hospital. I'd like to emphasize the point that it's actually safer to come to the hospital, to Tampa General Hospital, than it is to go to a restaurant or to a bar or be out and about. We have done an incredibly good job of segregating the patients with COVID and keeping the rest of the patients, the non-COVID patients, incredibly safe and free of any cross-infection. So please don't delay your cardiovascular care. Seek help, seek medical attention as soon as you have any of the symptoms that Dr. Arthi Patel enumerated. So thank you for that, Arthi.
Thank you.
Now I'd like to invite Dr. Shames, Dr. Murray Shames, who's our Chief of Vascular Surgery and a co-director of the Tampa General Heart and Vascular Institute, to explain to us and give us some insight on how COVID-19 has impacted cardiovascular care and cardiovascular health in the population in general. Specifically, I'd like to ask Dr. Shames whether he feels there are any specific conditions that are associated with COVID-19 that impact cardiovascular health.
Thanks, Guilherme, and thank you for the invitation to participate in this panel. So I think there's a couple of ways to look at that, at the impact of COVID on cardiovascular disease and vascular disease. In particular, it's the sort of the delay in diagnosis that you mentioned and the patients that chose not to come to the hospital and had acute events. So whether that's acute coronary syndrome, stroke, aortic dissection, which was likely to go up on heart attacks and ruptured aneurysm. So while I think Tampa Bay was fairly well protected, if you look at what happened in some of the bigger epidemic areas like New York City and Boston, there was a significant drop in the number of patients presenting to the hospitals with these problems, especially aortic dissections and ruptured aneurysms. And we don't think that there's a seasonal or a protective role for COVID. So those patients probably just stayed home, were either afraid to come to the hospital or just maybe call 911 but couldn't get there because of the sort of the burden on the system or didn't have anywhere to go. So again, as mentioned by the other panelists, if you are having an acute syndrome, you are having a heart attack, signs of a stroke, you have tearing chest pain that would suggest you're having aortic dissection, or back and abdominal pain that might be associated with an aneurysm, don't delay. The hospital is safe, and we are here to help you. We did not stop operating on emergencies. So I think when we look back to March, April, and May, when we cut back on our elective procedures, both I think in the cardiac world and in the vascular world, we didn't do elective surgery. We weren't doing bypasses and aneurysm repair or fixing carotid arteries that were blocked on patients who were asymptomatic or who didn't meet the now more stringent guidelines. We're since mid-May, we have been open for business. We are treating all our patients as we did before COVID-19 started. The other concern is the complications, the cardiovascular complications of COVID, and those are quite variable and devastating. Some are minor, like just clots that form in arteries or veins, pulmonary embolus. We've had embolic disease to toes, hands, and feet, which can be treated promptly. But what we did see was a much more significant number of patients presenting with advanced disease. So unfortunately, during March, April, May, we performed many more amputations than we normally would have because patients waited too long to come to the hospital. And then there's the complications, so the aortic thrombus and some of the more complicated thromboembolic events that did occur during COVID, where the whole aorta clots off or massive clotting forming in the iliac arteries and veins. Both patients in the hospital on ventilators for prolonged periods of time and patients presenting with those symptoms. Now, fortunately, we have not had many of those at Tampa General Hospital, and we have not been forced to operate on people who are infected with COVID who have presented with those symptoms. But there have certainly been reports across the country of those, and they're typically devastating complications. So I think our team here, our intensivists, our cardiologists, our pulmonary critical care doctors, and our hospitalists have done an outstanding job of managing the patients, and our complication rates have been very, very low. I just want to echo what has been. The hospital is very safe. Our operating room teams and cath lab teams have been sort of educated. We have anesthesia protocols for patients with COVID to protect the team, to protect the surgeons and the anesthesiologists and our nurses and our techs. So everyone is engaged. We have made it incredibly safe in the hospital. I can't think of a case of transmission of COVID to a patient by a team member or from any significant number of team members that have gotten infected from patients. So just to sort of say, take care of yourselves. For patients out there with heart and vascular disease, we're here to help. The hospital is set up to take care of you, and don't delay your treatment. Thanks.
Thank you. Thank you, Murray. I'd just like to say again that all our team member infections, COVID infections, have been acquired in the community and not in the hospital.
Right.
And likewise, I cannot think of anybody in the hospital that came to seek care that ended up being infected with COVID by one of the team members. So again, it's incredibly safe to come and seek help at our hospital. Thank you for that. I'd like to now invite Kristen Lewis, who is our partner at the American Heart Association, and is responsible for the development and implementation of community impact strategies. What I'd like, Kristen, for you to do today is to share with us some of the initiatives that the AHA has in the Tampa Bay area about, and some resources about heart healthy initiatives. Whether they pertain to COVID or not, I think we want to hear it all.
Absolutely. Thank you again for having me on this panel. And we're very excited to partner with you in this initiative. And the first thing that I want to say is thank you so much to all of the panelists who have really been promoting this information about how the hospital is a safe place to be. One of the initiatives that we started after COVID hit was because of that exact issue. We saw that a lot of people were they were dying of doubt, and that's just the campaign, the Don't Die of Doubt campaign. People were afraid they were hesitating to call the doctor, hesitating to go into the hospital because they were afraid of contracting the virus. And the entire campaign is really just to encourage people who may be experiencing some symptoms that the hospital is the absolute safest place for you to be. So thank you. Thank you. I was smiling as you guys were talking about that because that's a huge thing that we're trying to increase awareness about in the community. But other great initiatives that we've been able to implement both before and during COVID, one is our Healthy at Home Toolkit. So on the American Heart Association website, we have information about how to stay healthy at home, recipes that you can make with the family that are healthy, and exercises that you can do with your family, with your kids, to get everyone active and give the kids some more things to do while they're in the house. Also, great information about how to self-monitor your blood pressure while you're at home. We know community members are not, going out and maybe are accessing the blood pressure monitoring resources in the community at a pub, at a grocery store, or at a pharmacy less, because they're spending more time inside. So we've got some initiatives on and some education on how to monitor and measure your own blood pressure. Something that has come out recently, which is we're very excited about, is our My Life Check app, which can be purchased on, or not purchased, but downloaded from the Apple Store or from the Google Store for apps. And the My Life Check app is really a health assessment where we're encouraging people to enter their health data. So maybe they just went and got a screening and they know their blood pressure and their blood glucose and cholesterol, and also ask questions about diet and physical activity, all of the things that we know are the greatest drivers for cardiovascular health. It provides not only an assessment to show you kind of where you are in achieving your ideal health, but based on what your responses are, it gives you actionable tools to implement right there on the spot. So if you're not doing so well in your physical activity, it gives you education and examples of how you can increase that physical activity, and improve the overall lifestyle that you have. Another thing that we are obviously promoting right now in the community is our Heart Walk. We're really excited that we have so many community members that are now going to be able to access the fun and the excitement and the education around our Heart Walk campaign. And now that we have moved to a digital experience for this year's Heart Walk, we're going to be able to engage so many more people that weren't able to attend in years past. And we're also having an entire week of healthy living activities that community members can engage with. So instead of just a really awesome walk on Saturday, we have an entire week of activities that they can participate in right in their own neighborhoods, right with their own families in their homes. And if you are interested in getting registered for Heart Walk, you're going to go to tampabayheartwalk.org/TGH 2020. So you can make sure you're in the TGH team and be able to participate and get all of the information from that event. And lastly, I'd like to mention a resource that's specifically for patients who are undergoing treatment for heart and other vascular conditions. On heart.org/coronavirus, there's an entire library of educational resources specifically for our patients, survivors, and those that might be at high risk for a cardiovascular event or cardiovascular disease. There we have Q&A with providers. We have tips on controlling blood pressure during coronavirus, how to separate fact from fear, and specifically what people with diabetes need to know, what people with high cholesterol, with hypertension need to know about how to manage their conditions during coronavirus. So really excited to be able to pivot a lot of our traditional cornerstone services to a digital format, while also being able to continue that same level of connection with the community. So yeah, hopefully that gives a little bit of insight.
That's a great insight. Can I ask you a question, Kristen, about the Heart Walk specifically?
Mm-hmm.
How is there anything going to change in the middle of the pandemic? Are people still going to walk together? Are they going to be asked to wear masks? Or how do you foresee this going?
Oh, yes, great question. So I'll give a little bit more detail about what Heart Walk looks like this year. So typically, we have a huge event. Tens of thousands of people are gathered at Raymond James. We have an awesome walk around the stadium, lots of fun and healthy activities around in that area. It's a great day of fun and education and being able to raise funds for this cause. So this year, because of the pandemic, of course, we're not all meeting together at Raymond James, but instead we will have, like I mentioned, a week long of virtual and digital experiences where people can participate in their own neighborhoods. Of course, we're encouraging people to maintain social distancing and also take any precautions that they would be, especially if they've been advised by their physicians to definitely stay in the house and quarantine. But for those who are able to get outside and be able to engage in some of the activities that we have, all of the digital experiences, all of the events are going to be for things that people can do with their own families or in their own neighborhoods, separately, but all working together to achieve this goal. A little bit different this year, but still getting people out there to walk and raise awareness.
Great, great. And just so that everybody knows, I am asking all our Heart and Vascular Institute members to donate to the Heart Walk. We're gonna have a big drive, and we wanna really achieve, key status for our Tampa General, at least healthcare community. So we're gonna really push hard this year.
Thank you.
I
Thank
invite
you
all
so
the
much.
panelists to contribute as well.
Thank you. Thank you. I'm really excited to see how Heart Walk looks this year and how we've been able to rally the community around this cause and the things that are able to be implemented right here in Tampa Bay to increase the health of this community because of your support and all of our walkers' support. So again, thank you very much for that.
Well, one of the things that I hear, and I like to even ask the panelists as well, is that because of the pandemic and because of quarantining and because of isolationism, people have struggled with things like maintaining their fitness level and their weight and their ability to continue to exercise. What does the AHA recommend, and what do our physician panelists recommend for patients with those concerns? Let's start with Kristen.
Sure. So we're definitely encouraging people to utilize the resources that the Heart Association has for them, absolutely free, to get different ideas about how they can maintain their physical activity. I think for some of us in the community, when the virus really came on site and things kind of shut down, we saw that we had more time. I saw lots of people in my neighborhood taking walks in the middle of the day or at night when the workday was done. And I feel like now that we're all getting used to this, more used, I should say, to this virtual engagement, this work from home life for some of us, I think that we've lost a lot of that. We've stopped taking the walks because during our lunch breaks, people know that we're sitting in front of our computer, so we'll just stay on and work a little bit longer. So maybe you don't have time to make that healthier lunch, and you're running out to grab something just like you were when you were working in the office. So I definitely encourage people to know that there are plenty of safe ways that you can continue your physical activity outside now the weather is getting cooler, and also in your home or with people that are in your family and you're already coming in contact with, but you can maintain those social distancing practices while also keeping up with your physical activity. And we're lucky and to be living in Florida because the weather is going to be decent enough for us to be outside for the remainder of the year. So I definitely encourage people to take advantage of that.
Any extra comments from our panelists? Anybody want to say anything?
Yeah, I think it's important that people find time for themselves. I think wellness is critical in this time, and to find time to exercise or do something fun. Like Kristen said, I think outside is obviously the best place to be, rather than in a gym or in a sports club. But certainly home exercise bikes have become widely available and are not overly expensive and can be used with all kinds of apps. Weights got impossible to buy. It took me 4 months to get my set of home weights so I could do my workouts at home. But I think, people have to pivot their choices, and instead of going to the gym, lots of stuff you can do with cheap rubber bands or online apps for exercise to just get your 15 or 20 minutes or 30 minutes a day. And then get outside. The weather's going to be great, as you said. And so I think people need to continue to maintain a healthy lifestyle. And I think being healthy and staying fit is the best way to get through this pandemic.
All right. Well, I thank you all for those insights. Now, um, what I like to do is shift gears a little bit and take some questions that were submitted, and they're still being submitted by the community to our panelists. Um, so I have one here, which I'm going to read out. Renee G asked the following question. It is the greatest gift to receive a donor heart. As a patient, I want to protect this donor heart for life. I have hesitation about taking a vaccine for COVID-19. What are your thoughts about this? Anybody want to take this one on? If not, I would volunteer. This is my area of expertise, and as a heart transplant cardiologist, but I would give anybody first dibs.
You go ahead, Dr. Oliveira.
Okay, so there are a couple of things about this, right? This is so we don't know what vaccine we're talking about yet. So, what is a COVID-19 vaccine going to look like? Is it going to be live virus? Is it going to be live attenuated virus? Is it going to be not a virus at all? Is it going to be RNA based? So at this time, the answer, and I appreciate the concern. You're absolutely right, Renee. Getting a donor heart is the greatest gift that one could get in terms of, I think, in the healthcare world. And it's absolutely your job and your obligation to protect that heart and make it last as long as possible. What I would say is that at this time, it's not clear. So we cannot give you any direction because we don't know the nature of the vaccine. Once we know the nature of the vaccine, for example, we do give pneumonia vaccines for all our patients with heart transplants. We give a lot of vaccines to patients, but it really is going to depend on what kind of vaccine comes out and what the protective nature of this vaccine looks like. It's a little too early to talk about vaccination without knowing, what's going to be coming down the line, and especially too early to talk about vaccination in heart transplant recipients. But as soon as as we know what vaccine is going to be made available, I invite you to give us a call at Tampa General Hospital. You can call my office, you can call our transplant office, and we'll be able to give you very direct instructions on how to proceed. Okay. So another question. Joseph writes, I have atrial fibrillation, atrial flutter, dilated cardiomyopathy, arrhythmias, and more. I have not been inside a building in the last 6 months other than my own condo. However, there are members of my family that do go visit their friends and family and then come back home to me. How do I protect myself? What is the probability, given the odds, someone will bring it back home to me? And what can I do now to best protect myself? I think I'm going to ask Dr. Patel to tackle that one.
Sure. So, I think this is a very good question, a very common question and concern that patients have. You may be doing everything that you can to protect yourself from the virus by isolating, but what do you do about the other people around you? And so from what it sounds like, the particular question writer has some risk factors for being high risk for contracting coronavirus or having issues if they contracted the virus. So I think it's very important to do a couple of things. One is maintaining you yourself, continuing isolation as much as you're able to do so, making sure you're washing your hands. Wearing a mask is very important if you're outside of your home, or if you're going to be inside of your home with someone who you think may have been exposed to coronavirus. And then in addition to wearing a mask, maintaining that distance of 6 feet away I think part of prevention of coronavirus is education and really talking to your family members, making them understand that you are at a higher risk. So just taking the extra precaution to ensure that they're not putting you at risk as well. We do know that some people can be asymptomatic. There's varying degrees of presentation and effect that the COVID virus has on different types of people, different ages. So again, I think just paying particular attention to what you can do and how you can educate the people around you on what your risks are and hoping that they understand that. Now, the question about the odds of contracting it from someone, that's a difficult question because it depends on what exposure your family member may have had to someone who has coronavirus. We do know that if somebody has coronavirus and is symptomatic, if you're not wearing a mask and you're within 6 feet of them for a prolonged period of time, anywhere from 15 minutes or above, that there is a high chance that you can contract the virus. So paying attention to if your family members have any symptoms is also very important, but I don't think that anyone can tell you what the odds are because there's so many different scenarios. So again, educating those around you, visiting the CDC website. I know Kristen mentioned the American Heart Association website has some great resources for patients. And then just doing what you can to protect yourself, I think, are the best ways to avoid the virus.
Murray, any other tips for Joseph? Thank you, Arti, for that answer.
Yeah, thanks, Cameron. I think what Arti said is clear. I think just being vigilant about your own personal protection. I think if somebody coming in and out of your house is in a high risk environment or is not engaging in safe, COVID practices, is, I think there are certainly opening up of the community is going to increase the number of cases. Not everybody's going to get it, but there's certainly a concern if you're in crowded places, in bars and restaurants, the people around you are not wearing masks. I think if you're in an environment where you're wearing a mask and your coworkers are wearing masks and you're staying safe at 6 feet, washing hands, I think the risk of transmission is quite low. But with somebody, I think for all people who are at high risk, who either have comorbidities that put them at high risk or older age or in environments that are high risk, just be cautious and keep your distance and maintain, your hand washing. I think those are just, it's been shown to reduce the risk of transmission across the board. And so, I think as healthcare providers in the community, we like to set an example, and we certainly are doing that at home and in the hospital. So I think we just all need to just take care of ourselves, but also care about others. And that's really the important message right now. This is a public health problem. This is not my problem or your problem or anyone on this panel. It's a public health problem. The more we all do, the better we all do.
And now with this pandemic, we have, mutual accountability to one another. So, Joseph, I would say from my standpoint is I would hold whoever is undergoing unsafe behavior accountable because your health is at stake. You do have a higher risk profile, especially with the dilated cardiomyopathy, in that if you acquire COVID, you're at high risk for complications. So I would definitely make that understood and hold whoever needs to be held accountable. Next one, this one is for Dr. Matar. Dr. Matar, another Renee, asked the following question. When will transcatheter mitral valve replacement be available at Tampa General Hospital?
Currently, we have transcatheter mitral valve repair, which is the mitral clip. What Renee is asking, when will we have the actual valve that we can replace without cutting the chest open? We are fortunate at Tampa General to have actually one of the inventors of the Tendyne valve, which is the mitral valve replacement procedure that we are going to be able to use. Currently this is not approved by the FDA for general use. As soon as we get that approval, we will be able to start using it. And I'm not sure when the FDA is going to approve the Tendyne, which is made by Abbott. So, but rest assured, as soon as the FDA approves it, and that's going to happen, and we will be the first to use it in Florida.
Wonderful. So now I know that transcatheter mitral valve replacements have occurred. You can go through the apical approach, right? And you can do a valve-in-valve. Have we done that at Tampa General?
Yeah, we are currently, we are able to replace the mitral valve prosthetic valves, meaning somebody who had a prior mitral valve that was placed surgically, which failed. We have been doing that quite a bit, actually. We can go through that old valve and we can use the aortic valve, which is the valve that's approved for the aortic position. We have been implanting it through the old valve using the transcatheter approach by going from the right side of the heart, crossing into the left atrium, and then going down. And we have been deploying those valves. The issue is replacing a native defective mitral valve right now is not a good idea to use this approach, because this current valve is not designed for this. The aortic valve is not designed to replace the native mitral valve, because there's no anchoring system of the native mitral valve. So the better way to use it, to do it, is by using either a transapical approach, using that Tendyne valve. By the way we do it, we expose the apex of the left ventricle surgically, and we go with a needle with a beating heart, and then advance the catheter, and from there we can advance this new valve with a well-designed anchoring system so that the valve stays in place. Now, this is not approved yet, but it will be, and we should be hopefully using it soon at Tampa General in a commercial approval. Now, for patients who have mitral stenosis, for example, rheumatic heart disease, we have been able to fix that with balloon valvuloplasty, which worked quite well. For patients with severe mitral regurgitation, meaning leaky valve, we've been able to repair it with a transcatheter mitral valve repair, which is the MitraClip. We can go also from the right heart. But for patients with degenerated mitral valve stenosis that are not, or regurgitation not candidate for repairs with the MitraClip, these are the ones that we hopefully will be able to use the Tendyne catheter for it.
Great. Well, thank you. So just to clarify, we do transcatheter mitral valve replacement on an old mechanical prosthetic valve, on a prosthetic valve, but not in native valves, correct?
Correct.
So yeah, we do replace those. If you have any such issue, come and check out, talk with Dr. Matar. Dr. Matar will give you a whole array of options. Next one, this is a rather personal question. One asks us the following thing. Once I found out I was COVID positive, I wasn't too worried or anxious. But then 4 days into my diagnosis, I was watching TV and my heart started palpitating, which fueled anxiety and now won't leave me alone. My resting heart rate is now over 100 beats per minute. And when I take a shower, it goes up to 145 beats per minute. Is this common for COVID positive people? Why is this happening? Anybody volunteer to take this on?
I can take that on.
Okay.
As we still don't know the full story of COVID. There have been reports of arrhythmias and palpitations in COVID positive patients. Some of those are atrial fibrillation, some of them are atrial flutter, but some of them could be inappropriate sinus tachycardia. I am not sure which one of those you have. I'm pretty confident that if you spoke to your physician, then they would have done a monitor or something to decide which one of those. Let's assume that atrial fibrillation or flutter was ruled out in you. It sounds like you have what we call inappropriate sinus tachycardia, meaning the metronome of the heart that normally tells your heart what to do. If you're running, your heart rate should go up. If you're sleeping, the heart rate should go down. That metronome or that center it became defective, and we still don't know how that would happen with COVID, but there have been reports of that. If that's the case, the patients such as yourself will have extreme fatigue. Your heart is working extra hard, but that becomes less efficient. If that's the case, the treatment is the typical treatment of inappropriate sinus tachycardia that we have, and there are specific medications we use. Some of them are beta blockers, and some of them are newer agents such as Corlinor, which is a new agent that can slow the heart rate and give symptomatic relief. So if you have anything like that and you still need help, we'll be happy to provide a second opinion to help you out.
Okay, so the short answer, I'm just going to summarize if it's okay with you, Dr. Matar, is that no, it's not normal to have a heart rate of 100 to 145. Go to the doctor, seek your cardiologist, and don't wait around. And this is basically the message for anybody having any kind of symptoms. Like Dr. Patel said a while ago, if you have symptoms, don't wait around. Don't assume it's normal. Just go get it checked out. One more question here. We have two more questions. I think we have a little bit of time. This is an anonymous question. So as we are learning more about COVID and the patient outcomes, what are the greatest concerns regarding long-term negative effects? After recovering from COVID-19, is cardiovascular damage a common complaint? Murray, you want to take that?
So, I think we don't really know. There's no sort of pathology that is consistent amongst everybody. I do think that there are known cardiac complications, cardiomyopathy and damage to the heart that occurs. We don't know what the impact on the peripheral vascular circulation is, but certainly there have been patients, like I said, who have developed DVTs and arterial emboli, which can lead to long-term complications. So I think caution, seek treatment immediately, get back to regular health as soon as possible. I think the impact on the pulmonary system, on the lungs, has been been profound, and some people have developed asthma and COPD, and certainly if you've been intubated or on heart-lung machines for support, there's certainly a much higher likelihood. But I think, again, go to see your doctor. If you've had COVID and still not feeling well, there might be some complications. You might need to have some imaging studies, an echocardiogram, an ultrasound, at least an EKG, so that we can help, so the healthcare providers can assist you in getting yourself back to normal. I think this disease is so poorly understood. It's been 8 months. We've learned a lot. We understand its biology, but the clinical impact has been so variable, from asymptomatic young children to neurologic complications, cardiopulmonary complications, other certainly multi-system organ failure that have occurred. So, I think we just need to stay aware and collect information and take this thing seriously. This is an ongoing problem, and it has not disappeared. And while I think we've made significant impact on the morbidity and the mortality, I think Tampa Bay has been very well protected, but also because of the vigilance and care and coordination of our healthcare system in the city, we've done a really good job. But we need to take this seriously. It's a real problem.
Yeah. Well, thank you for that, Murray. I just wanted to say to whoever asked this question that USF Health, in partnership with Tampa General Hospital, are setting up follow-up clinics of cardiovascular comorbidities from COVID. We don't know exactly, like Dr. Murray said, Dr. Shame said, we don't know exactly what the long-term outcomes are going to be. We know that there's a reasonably high prevalence of some small abnormality. We were calling it myocarditis or inflammation of the myocardium, but we don't know what the long-term implications are going to be. Hopefully they're not going to be too horrible, but we just don't know. And I'm going to try and squeeze one last question here from our Facebook chat. The question reads, if you're on a biologic for ulcerative colitis, are you more at risk for cardio issues or COVID-19? And I like to take that one on. The short answer appears to be not necessarily, even though we think that people that have some more comorbidities may have more complications. It appears there's a recent study from Spain suggesting that people on biologic therapy or immunosuppressive therapies actually are at lower risk, perhaps, for developing severe complications from COVID. And the reason between that is that they don't mount such an overwhelming immune response, which is part of the pathophysiology, part of the reason some people get really sick. So if you're taking biologics or immunosuppressants that keep your immune system downregulated, you won't perhaps get as sick as others. Having said that, this is all, we're still learning. It's all preliminary. We don't really know yet. So it's going to be a question of wait and see, basically. And so I think with that, we're coming to 2 minutes before the end of our panel here. I would like to thank all the panelists. I'd like to thank Dr. Murray, Shames, Dr. Fatima Tara, Dr. Arthi Patel, and Kristen from the American Heart Association, Kristen Lewis. Thank you so much for joining me today. Again, I'm Dr. Oliveira at Tampa General Hospital, and I'm delighted to have conducted this panel. As I mentioned earlier, our friends at the American Heart Association have multiple resources to assist you with your heart care, your cardiovascular care, ways to cope during the COVID pandemic. And from us at Tampa General Hospital and University of South Florida, we are here to help. We are available 24/7. And please, please, please do not delay any of your cardiovascular care or any health care for fear of contracting COVID in the hospital. It won't happen. It is safe. If you need to, come and seek us. Thank you so much. And with that, I will end today's session. Thank you very much.
Thank you. Thank you.
Done.
Thank you, everyone. It was phenomenal.